So again, you want to go ahead and take out some notes, and this free crash course is being brought to you by LW Pharmacy School, okay? We're going to jump right into it. So the reason why we're going to talk about pharmacy billing tonight is because a lot of what's going to be on your exam is coming from the pharmacy billing. Remember, the exam is catered towards retail pharmacy, okay? And so it's important for you to understand how the retail pharmacy operates as well as the billing. The billing is very, very important to you, okay? Managed care providers. And so your managed care providers is HMO, that's your PPO. And HMO stands for Health Maintenance Organization. Health Maintenance Organization is what an HMO plan stands, or what HMO stands for. Okay, healthcare providers. Healthcare providers work directly for HMOs. Okay, so that's your doctors, your nurses, pretty much anybody, the physicians that are providing any type of healthcare services to you or to the individual. Your PCP. Now, with an HMO plan, you will, be required to select a PCP. The PCP is the primary care physician, and that is the individual that the patient goes to see whenever they're having some questions or, some worries or things like that about their health. They are going to see that particular PCP doctor, okay? And then there's a small copay, okay? So whenever you go to the doctor on an HMO, there may be a $30 copay, there may be a $40 copay for regular visits, and then if you are seeing some type of expert or some type of specialist, then that copay may increase a little bit, okay? So those are just some of the things you want to know about HMO, okay? Let's move on to PPOs. Now, PPOs is the Preferred Provider Organization, the Preferred Provider Organization, okay? And that PPO provides healthcare services to members at a discounted fee for service, okay? When you are working with a PPO, you can use any doctor in network or any doctor out of network, and that's the advantage of having a PPO. Members will pay a copay at the time of service, and, they may be able, again, to work with whomever they want to work with outside of their network or inside of the network. As to where here, HMOs, it has to be in network, okay? It has to be in network for an HMO, have to select a primary care physician, and then you have to get a referral if you want to go and see a specialist, okay? Now, for some people, that may not matter because you have some people who don't really go and see specialists a lot, and so they say, well, I want the HMO. Typically, an HMO plan is a lot cheaper than a PPO, okay? Here, we're going to talk about a little bit about the federal funded healthcare programs. Now, federal funded healthcare programs is Medicaid or Medicare, okay? There's an easy way to remember the 4 parts of Medicare, and this is where you may want to take some notes if you haven't started already. Part A covers hospital. Part B covers medical insurance. Part C covers, allows the patient to obtain coverage through an HMO or PPO that provides additional services. And then Part D is for prescription drug plans, okay? I'll repeat that again. Part A is hospital. Part B is going to be medical insurance. Part C is any additional coverage that the patient may need. And then Part D is going to be the prescription drug plan. And that's when we come into the picture, okay? And so when a person or an individual who is using Medicare, they need to make sure when they get ready to come to the pharmacy that they provide us with that Medicare Part D card, or that they have that somewhere in their plan, because that's what's going to cover their actual drug prescriptions. It's not going to be Part A, B, it's going to be the Part D that covers it, okay? And so we want to make sure too that when those individuals come into the pharmacy, that they can provide that type of coverage and show us that they actually have it. Now, this is going to be very crucial to you because inside of the pharmacy is where all of this stuff really matters, okay? But it also matters on your PTCB exam. Remember, the exam is catered towards retail pharmacy, community pharmacy, and that's because the majority of individuals inside of the world goes to a retail pharmacy, not necessarily a hospital or an outpatient. It's always retail, okay? So your test is geared towards the retail pharmacy. It is really your responsibility to educate yourself on the billing inside the pharmacy as much as you possibly can. Okay. The next program that's federally funded is Medicaid. When you think about Medicaid, think about women and children. Think about women and children with Medicaid. Okay. So you have Medicaid and then you have CHIPS. Okay. You think about children, and typically for kids, they need to be under the age of 18 and under. And then women, are normally pregnant. And so those are the ones that can actually get the Medicaid. And it's based on income and other circumstances, okay? Each state determines its own eligibility rules, services provided, and copays. The eligibility goes on a month-by-month basis. So if a person has it this month, they need to make sure, that their eligibility stay intact for the next month in order for them to continue to receive services. That's another reason why when patients come into the pharmacy, we want to update their profile and we want to update any information that they give us. We also want to ask them, hey, has anything changed? Has your address changed? Has your phone number changed? What about your insurance? Because those type of things matter when it comes to making sure that when we submit the claim to the insurance that we're going to get a paid claim. We don't want to get a claim, especially after we've told the individual, hey, it's going to be 45 minutes in order, for you to get your prescription. And then when they come, it's like, well, it's been 45 minutes, but we didn't get a paid claim. That's pretty irritating to the customer, okay? And so again, one of the ways that we can prevent that is just making sure that we update their profile information as much as we possibly can whenever we see them. Pharmacy reimbursement from managed care, okay? AWP, this is another good one you want to write down. The AWP stands for average wholesale price, okay? This is not regulated by the government and it does not take into account any discounts, okay? So again, AWP is average wholesale price, okay? It is the average price that a wholesaler sells a medication. AAC, actual acquisition cost. That is the actual cost that the pharmacy paid for the medication, okay? So when we talk about the AAC, the pharmacy can charge an AAC plus a dispensing fee in order to try to make some of that profit back, okay? And so again, you wanna make sure if you're not taking down any notes, this is a time for you to kind of get in there and start kind of jotting some things down, because these are some very crucial terms that you will see on your board exam, or if not on your board exam, you will actually see these inside the pharmacy as well as you work your way up. And so I encourage you to take some of these notes here. And then the next one is the maximum allowable cost. Okay, this is used when it's time to calculate the reimbursement formula for generic medications, and the maximum allowable cost is going to be, one fee. So you may have $10 for the maximum allowable cost, and then you may have a dispensing fee of $2.50. Okay, and that's typically determined by the managed care organization. Who is the managed care organization? That's the HMOs, like your Blue Cross Blue Shield, your Aetna, okay, your Humana, okay, PPOs, okay, still Blue Cross Blue Shield also has a PPO plan, so does Aetna, so does Humana. It's almost like, you can go to McDonald's and you can say, hey, I don't want to supersize my meal, I just want to get the regular meal, okay? So the regular meal would be the HMO, and then PPO could be compared to supersizing. So I just want to let you know that pretty much every organization, every healthcare organization, managed care organization has HMO and PPO for both, to offer to both individuals, or to offer to individuals, period, okay? Online adjudication. Online adjudication is something that is pretty cool and pretty fascinating, especially when you're working inside the pharmacy. And you'll see this quite a bit, where you are processing a prescription, electronically to a third-party provider. And as soon as you process the prescription, you get a receipt, and learning or seeing that the claim was actually processed. And that's pretty cool, because it's just as quick as tapping the button. As soon as you click that button, that provider or that third-party provider has just now received that claim, okay? And they can either deny it or they can keep it. It's just kind of up to them. And it's so the online adjudication is the process by which a pharmacy submits prescription claims electronically to a third-party provider when filling a prescription to ensure accurate co-payment and timely payment. okay? When we are inside the pharmacy and we are submitting these particular payments to a third party, it's important that at that time we submit it as soon as we type up the prescription, we're going to press enter and we submit it. Once you press enter and you submit it, typically a leaflet will pull out, and that's pretty much the hard copy that the patient is going to get. And that prints out and that lets us know that, hey, we've gotten a paid claim. And then if nothing prints out, or if something prints out that says a rejection, then, we know that the prescription has just got rejected. It has been a complete pleasure, a complete joy to work with you guys tonight. I enjoy every opportunity that I get to give back and to serve you guys in this capacity. Again, you're on the right track.